Welcome to the Rising to Resilience Learning Course Series. This is Class 4 of a 7-course series. Class 4, Resilience Through Healthy Relationships. This class will provide an overview of healthy relationships, listening, and showing care. Research has shown that having trusting, safe, and supportive relationships with peers, family members, colleagues, mentors, and religious leaders is critical to building our resilience so that we can face life's stressors. To maintain healthy and positive relationships, there are 3 steps you can follow. First is to take inventory, second is to work on listening, and third is to show you care. Healthy and positive relationships, Step 1. Take inventory. When taking an inventory of your existing relationships, it is important to start by considering what kind of relationship it is. We hold relationships with family, friends, colleagues at work, mentors, spiritual leaders, teammates, classmates, and romantic partner. Each of these types of relationships will be comprised of different dynamics, boundaries, and expectations. Good questions to ask yourself when examining your relationships include: which of these relationships is energizing, supportive, and trusting? What are the boundaries and expectations in this relationship? Have these been clearly communicated and mutually agreed upon? When seeking out and developing new relationships, you may consider: how have you met the people in your life that you are closest to now? Seek out new relationships by joining a new community. Is there a cause you are passionate about where you might like to volunteer and meet like-minded individuals? Perhaps there is a particular hobby or activity you would like to pursue a class in and connect creatively with others. Or maybe you lost touch with somebody and you'd like to reach out to reconnect with them. Finally, knowing the signs that may indicate an unhealthy relationship will help you maintain boundaries and advocate for yourself. It is important to know the signs of an unhealthy relationship and to be able to recognize when the dynamic may need to be addressed. Please note that an unhealthy relationship is not necessarily an abusive relationship. Here are some signs that indicate a relationship may be unhealthy. You don't feel seen, heard, and understood by the other person. You don't feel comfortable saying what is on your mind. You feel that in any conflict it is always your fault. You are afraid around the other person, and you don't enjoy spending time with the other person, or it feels like a chore. Here are some additional signs that indicate a relationship may be unhealthy. You don't feel good about yourself or positive after spending time with them. You receive frequent criticism or put-downs from the other person. They try to create distance between you and other people in your life. And your relationship is characterized by lying or manipulation. The National Domestic Violence Hotline provides essential tools and support 24 hours a day, 7 days a week, 365 days a year to help survivors of domestic violence so they can live their lives free of abuse. Call 1-800-799-SAFE, or you can text START to 88788 or visit www.thehotline.org. Download a PDF with these resources in the File tab. Healthy and positive relationships, Step 2. Work on listening. With any of our relationships, be it with work colleagues, clients, patients, friends, family members, or a romantic partner, deep listening is an important skill to practice. Deep listening is the first step toward compassion. It is essential to avoiding miscommunication. It is a form of contemplative practice, and deep listening can be taught and learned. Poor listening is indicated by interrupting, attempting to relate with a personal story, attempting to demonstrate expertise on the speaker's experience or life, checking a phone or watch, poor eye contact, attempting to convince that this isn't how things really happened, and closed body language, such as facing away from the speaker and having crossed arms. While deep listening is indicated by good eye contact with the speaker, nonverbal cues of engagement, such as nodding, small gestures, or facial expressions, patience as the speaker talks, focusing on the speaker and not on other distractions in the area, and open body language, such as facing the speaker and leaning forward. Overall, good listening is important in both our personal lives and in our work lives. Demonstrating that you are truly listening attentively can impact how others feel about you, themselves, and influence the relationship that you have. Do you have someone you can turn to and be open with? Are you someone that another person can count on to listen to them? Healthy and positive relationships. Step 3. Show you care. To develop healthy and positive relationships, it is important to show that you care about the other person. There are many ways to show that you care. Your care can be demonstrated through acts of service, such as doing the dishes without being asked, spending quality time with the person you care about, such as doing an activity that you both can enjoy together, listening to the other person and what they have to say, providing affirmations and compliments to the other person, such as reminding them that you love them and how awesome you think they are, giving gifts, and finally physical touch, such as a warm and comforting hug. If you are comfortable, please take some time now to read and answer these questions on your own. Thank you for taking the time to complete Class 4, Resilience Through Healthy Relationships. The next course in the series is Class 5, Resilience Through Taking Action. For questions, comments, or more information, contact the Snohomish County Health Department Trauma and Resilience team by emailing SHD.Trauma&Resilience@co.snohomish.wa.us.